So first, maybe a few words about what our kidneys do. Usually we just think of them as filters, and we think, well, if I drink too much water, my kidneys are going to be working and I'm going to have to run to the bathroom. And that is true. If you drink enough water, though, you'll stay in good shape running to the bathroom. But they do much more than just that. They do filter your blood. They filter out the byproducts of protein metabolism and nucleic acid metabolism. They also purify the blood from toxins. They can help with your electrolyte balance, the sodium, the potassium, magnesium, and other electrolytes and minerals. They help the body maintain the proper acid load, the proper pH. But they do some other things too. They secrete a hormone called erythropoietin that helps your body with production of red blood cells. And so that is important too. If you develop kidney failure, one of the things that happens is you become anemic because your body's not making enough erythropoietin. You also need your kidneys so that you can convert vitamin D to its active form. So the kidneys perform many different functions, and as you know, if your kidneys aren't working, you can't live because you need their function. And so without kidneys, then there's dialysis, and that's a wonderful thing if you don't have kidneys, but we'd all rather spend our time doing other things than dialysis. So protecting our kidneys is really important. The other interesting thing is, as the kidneys start to become less effective in their job, we start having other problems, including increased risk of heart disease, because the kidneys and the heart have to work hand in hand to maintain that proper fluid balance. And as your kidneys fail, your rates of coronary artery disease and heart attacks and congestive heart failure go up as well. So protecting your kidneys helps your body in many ways. The first thing, and most important perhaps to keep in mind with kidney function and protecting it, is to remember that if you keep your blood pressure normal, then your kidneys will be much happier. Anytime you have high blood pressure for any length of time, your kidneys are stressed. Kidneys, if you will, are just a mass of very intricate blood vessels. And if your blood pressure is high, blood vessels deteriorate. They suffer from that high pressure. So keeping your blood pressure down is very important for kidney function and maintaining it. So first of all, I want to talk just a little bit about how to keep your blood pressure normal. And you all know that if you have too much salt, too much sodium chloride, that's going to raise your blood pressure. The question is, how soon will it raise your blood pressure? Well, as a matter of fact, if you have a high salt meal for supper, within the next 3 hours, your blood pressure will be elevated. In fact, it starts within 30 minutes of eating. If it's a high salt meal, your blood pressure goes up. That's one of the reasons why heart attacks often occur after a meal. If it's a high salt meal, the blood pressure goes up, the workload of the heart goes up, and then already you're at increased risk for problems from that salt. Salt does a number of things. One of the things that it does is it stiffens the arteries, the capillaries and the little arteries and the large arteries. Within just a few 30 minutes or so after eating, the arteries actually become stiffer. when we think of a house, we think of structure, and it's solid and it doesn't change. That's not true with your arteries. The arteries can get harder and they can get softer based on the chemical bonds in the cytoskeleton of the artery. And so if you have a high salt meal, a high sodium meal, the arteries stiffen. If you then decide, well, I don't want stiff arteries, I'm going to limit my sodium and I'm going to increase my potassium, the reverse occurs and you actually soften the arteries with a high potassium diet. Now that's why I really like what we had this evening for our food demonstration, because it has greens in it, and spinach is very high in potassium. Cabbage has quite a bit as well. The cauliflower doesn't have as much potassium, but the beans are very high in potassium. And if you have that high potassium intake, you'll soften the arteries, and that occurs within 30 minutes up to 3 hours. You're softening those arteries. And when you have softer arteries, then when the blood pumps in, they're more elastic and your blood pressure isn't as high. But that's not the only thing that occurs when you have sodium and potassium in your food. If you have a lot of sodium, not only does it harden the arteries, but it also decreases nitric oxide synthase. Now, nitric oxide synthase is an enzyme that is essential in the production of nitric oxide. Nitric oxide is produced by the cells that line the arteries and the little capillaries, and when you produce nitric oxide, that relaxes the blood vessel and dilates it, and as a result, your blood pressure comes down. Now, normally our bodies make plenty of nitric oxide. If they don't, and we're having problems with our arteries, like you have if you have chest pain from angina or angina, whichever way you like to say it, you take a nitroglycerin pill and you put it under your tongue, and that facilitates the production of nitric oxide, and it dilates your blood vessels and your blood pressure drops, and then hopefully the chest pain goes away, or you take another nitro. But if you're eating properly and you have low sodium and high potassium intake, the nitric oxide is produced normally. As I mentioned, sodium decreases the activity of nitric oxide synthase, whereas potassium increases the activity of nitric oxide synthase. So it's not just how much sodium you're eating or how much potassium, it's the balance between the two. And we want to have our diets high in potassium and low in sodium for that good production of nitric oxide synthase and for softening of the arteries. Now, some of you who have kidney disease may say, well, I know, but I can't have a high potassium diet because my kidneys won't excrete the potassium. And that is true. If you have advanced kidney disease, you have to be very careful with your potassium, because if your potassium level gets too high in the blood, it can be lethal. With normal kidneys or even slightly impaired kidney function, you can get by with a higher potassium intake, and the higher you can get it within reason from your food, the better you're going to do as far as blood pressure, and then you'll protect your kidneys. It's interesting, I've had a number of patients who had rather impaired kidney function and had to be very careful with potassium intake. But as we change their diet, change their protein, as I'll talk about shortly, and other dietary constituents, their kidneys improved enough that they could then liberalize their potassium intake and did very well and reverse some of these problems. So that's sodium and potassium, very important, and the first step in normalizing your blood pressure and protecting your kidneys. We all hear about exercise, probably we're sick of it, but exercise is very important to control blood pressure. And we used to think that you have to get out there and really work and sweat, but there are some recent articles that show that stretching exercises do just as well as vigorous physical activity for lowering blood pressure. The take-home lesson on that is this: for you to get maximum benefit in blood pressure lowering from your exercise, it should be relaxing exercise. If your exercise is out there knocking a ball around and you're just really tense because you want to win this game, you probably won't get the benefit from exercise that you would if you relaxed a little and enjoyed the exercise. So if you can't get out there on the tennis court or the basketball court, or if you're not a track star, maybe you can become a stretching star and lower your blood pressure from stretching. If you think about your cat at home and how the cat likes to stretch, and you know, I haven't seen a cat with high blood pressure recently. Maybe there are some. If they are, they need to stretch a little more. But stretching is very helpful, and walking is good. Any exercise that relaxes you. Deep breathing exercises will also lower your blood pressure. There's several studies that show that if you slow your breath rate down to less than 10 breaths a minute, that it will, and do that for 10 to 15 minutes a day, it will drop your blood pressure 5 to 10 points. That's about as much as a medication does. So just slowing down, pulling out your watch and watching your breaths per minute. If you do that, breathe in through your nose and out through your lips. If you purse your lips a little bit and blow out, can't see that under a mask, but you can try that. If you do that, nice deep breaths in through your nose, out through your mouth, you can slow your breaths down often to 3 or less breaths a minute. And as I've done that with patients in my office who came in with very high blood pressure, and often I'll see a 20-point drop in the systolic blood pressure just with 5 minutes of breathing exercises. They're relaxing themselves, and any exercise that relaxes you will drop your blood pressure. Another thing that you can do is increase your fiber intake. Now, if you had this dish tonight, you would have a very high fiber intake. The beans are rich in fiber, the cabbage is rich in fiber, the spinach is, and the cauliflower is. And all of those fiber-rich foods will lower your blood pressure. You say, well, how does that happen? It works by a very interesting mechanism that we've talked about before, and that is through the effect of fiber on the microbes in your gut. Your microbiome has a lot to do with inflammation. If you eat a diet that's rich in fiber, you switch the bacteria in your gut to those that reduce inflammation. And as you do that, the inflammation drops and the blood pressure drops. So I wish you were here tonight to taste this. Hopefully at the end of our lecture we can share it around, and maybe next time I can tell you how good it was. If you could just smell this here, it's probably good that I have a mask on because I'm drooling a bit right now smelling it. But if it tastes half as good as it smells, you'll all want to try that recipe. So increasing your fiber intake will lower the blood pressure. The other thing that will lower the blood pressure is reducing your intake of foods that raise your TMAO level. Well, what's TMAO? That stands for trimethylamine oxide, and that is something that is made by the gut bacteria but a particular class of gut bacteria. They're gut bacteria that like to eat carnitine and choline. And if you have a lot of carnitine and choline in your diet, then you will select for bacteria that like to eat those. And when they do, they manufacture trimethylamine oxide. Now, trimethylamine oxide also causes inflammation, and it will raise your blood pressure, but it has another effect. It has a direct effect on your kidney function and impairs it. Now, the question, of course, is what are the foods that are high in carnitine and choline? Well, in a plant-based diet, if you use lecithin, lecithin is rich in choline, and if you use enough of it, you will select for those gut bacteria that make TMAO. Or if you are a weightlifter and you think, boy, I've got to have some of that carnitine, there are some popular drinks that are rich in carnitine, which, by the way, you don't need to build muscle, but you do need that carnitine if you're going to support the companies that sell those drinks. But if you drink a lot of those carnitine drinks, you'll select for gut bacteria that make TMAO. I wouldn't do that. However, the main sources and the main problems are in, you might have guessed it, meat, milk, eggs, cheese, and deep sea fish. Trimethylamine is an interesting substance, and it keeps the deep sea fish a little more flexible when they're under pressure. And so the fish that are deep in the sea have higher levels of trimethylamine, and then when we feed that with the choline and the carnitine to our bodies, and it gets down to the gut bacteria, they change it into trimethylamine oxide, and then we have the problem with damage to the kidneys and raising of the high blood pressure. Another very simple thing is if you lose a little weight, you'll drop your blood pressure. Every pound of fat has a mile of blood vessels, and if you do the math, if you're 10 pounds overweight, and if your heart's beating at 60 times a minute, and they're 1,440 minutes in a day, 10 pounds overweight will have you pumping blood to the moon and back that you wouldn't have to if you didn't have those 10 extra pounds, and that would put a load on your heart, and it causes high blood pressure. The other thing that's very interesting is if you're overweight, you have hyperfiltration in the kidneys. That is, the kidneys have to do a lot more work if you're those 10 or 15 or more pounds overweight. I had a gentleman in my office today. I told him that I was lecturing on high blood pressure tonight. I told him I wouldn't use his name, but it was very interesting. On my computer, I have the ability to graph things. And so I graphed his weight against his blood pressure. And as his weight over the last 5 years had gone up and down, his blood pressure had followed. As his weight went up, his blood pressure went up. As his weight came down, his blood pressure had come down. And it's a direct result of that hyperfiltration and also the effect of more length of blood vessels and increased work on the heart. So if you're overweight, lose weight. For every pound of fat, there's a mile of blood vessels that you don't have to use if you lose that weight. There's another thing that I've alluded to already, and that's nitric oxide. Nitric oxide, as I mentioned, its production goes down when you have high salt diets. It goes up when you have a high potassium intake. But there's some other things that affect nitric oxide production as well. One of them is sunshine. The more sunshine you get, the higher your nitric oxide levels. That may be why it seems to me anyway, that when I'm out in the sunshine and it's warm, I tend to relax. And you just feel good when you get out there and get some of those rays. Now, I don't want you to get a sunburn. Stop short of that, because we don't want you to get skin cancer, but sunshine is very good for you and has been shown to lower blood pressure. So maybe this time of year we should, when the pandemic is over, get into the habit of seeking a southern clime and getting a little more sunshine if we have high blood pressure. But there are some things we can do right here. We know that your nitric oxide level will go up if you eat foods that are rich in nitric oxide precursors. And there are two major ones. One is arginine and the other is citrulline. And if you have diets that are high in arginine and citrulline, you'll make nitric oxide more easily. One of those is a leaf vegetable called arugula. And arugula does so well at producing nitric oxide that it's sometimes called the Viagra of vegetables. Of course, Viagra, the way it works is it increases nitric oxide in the circulation of the genitals, and so it helps with lubrication in women and also maintaining erections in men. Beets are equally good. In fact, beets are often used by athletes because they dilate your arteries enough that they improve your ability to do athletics. If you dose with beet juice the night before you go out on a marathon or any other physical activity, the average improvement in your VO2 max, which is your ability to consume oxygen when you're working, the improvement is about 3 to 5%. And if you have about a 3 to 5% improvement, you're going to win that race if nobody else does the beet juice. Beets work just as well. You don't have to juice them, and you get all the fiber too. But you get that not only in beets and arugula, but you can get that same arginine in pumpkin seeds, and you can get it in spinach. And the citrulline is found in cucumbers and most of the melons. And so, you know, you eat those foods and you'll find that your blood pressure will drop. There are quite a list of foods that have been tried and shown to lower blood pressure. I gave you a handout there you may have, and they're listed, but let me just read them to you. Almonds have been shown to lower blood pressure, as have oats and split peas and lentils and beans like we have in our dish here. Avocados, which are very high in potassium, lower blood pressure. Berries lower blood pressure because of the antioxidants in them. Apples do, pears do, bananas are rich in potassium and will lower blood pressure. Broccoli does, Brussels sprouts do, quite a few things that you can eat. One of the ones that's been studied the most actually is flax seeds. There's several studies that took flax and they compared flax to enalapril, which is one of the more common blood pressure medicines, gave flax to one group of people and enalapril to the other. Both groups had high blood pressure, and actually 2 tablespoons of flaxseed a day ground up into flax meal lowered blood pressure more than the enalapril did. So they crossed over and then tried the enalapril group on the flax and the flax group on the enalapril and found the same thing. So if you find that you have high blood pressure and you really don't want to take that enalapril, try flax. Flax is a very interesting substance. It will lower your blood pressure. It will help arthritis, osteoarthritis particularly. It'll lower a man's risk for prostate cancer. It lowers cholesterol, and it'll lower a woman's risk for breast cancer. So you might say we should all be taking flax every day. There are some side effects, and I wouldn't start out right away with 2 tablespoons. I'd start off with a teaspoon and gradually build up. so that you can shift your gut bacteria and you won't get bloated and too gassy. But flax is a wonderful food. You do want to grind it, or else it'll go in and it'll come out unchanged. So grind those flax seeds up into a flax meal, or you can buy them ground, but if you buy them ground, make sure that you refrigerate it to keep them from oxidizing. So those are some of the ways that you can lower your blood pressure, and if you lower the blood pressure, you'll help your kidney function. Another way that you can protect your kidneys is shift your protein intake from animal protein to plant-based protein. Now, I've already talked about TMAO. That's found in people that eat lots of choline and carnitine, found in animal protein. But there's another part to that protein story, and that is the animal protein has higher amounts of amino acids that are sulfur-rich, and the sulfur-rich amino acids provide an acid load to the kidneys, which is hard on the kidney function. There have been many studies that have shown people that have some impairment in their kidney function, if they shift from a standard American diet to a plant-based diet, their kidney function improves. I had a patient some years ago who had diabetes type 1, and she had this since childhood. Her kidneys had failed. She had gone on dialysis, and then she had found a gentleman who said he'd be happy to give her one of his kidneys, and she was so smitten with this that they got married, and he gave her a kidney, and I followed them both. They were both my patients for a number of years. And after about 15 years, that kidney that had been transplanted started to fail. Well, he couldn't give her another one, and she came into me and she said, "Dr. Howe, you help type 2 diabetics all the time. Isn't there anything you can do for me?" And I don't usually put type 1 diabetics on plant-based diets, although it certainly won't hurt them. It can help them a lot, but it won't reverse their diabetes like type 2 often is the case. But I thought, well, let's try it. Her creatinine was running around 3, which is means you don't have much kidney function left. I put her on a plant-based diet, no animal protein at all, and her creatinine fell from 3 all the way down to 1.8. Still elevated, but her kidney function had essentially doubled just switching from animal protein to plant protein. And generally speaking, I see an improvement in creatinine or in kidney function by about 50% when we switch over to a plant-based protein because of the acid load difference and the TMAO. So it's been, as I mentioned repeatedly, shown that if you switch to plant-based proteins, you will definitely improve kidney function. And if you have kidney impairment already, I'd strongly encourage you to try that. It may buy you some dialysis-free time, and that's worth a lot. In fact, you may avoid dialysis altogether, and that would be even better. Another thing that you can do to protect your kidneys is to minimize glycation in your body. Now, I've talked about glycation before. Essentially what glycation is in the presence of high sugar, proteins and sugar attach together in an irreversible fashion. Now, our diabetics are all familiar with this because we measure a glycated protein all the time in diabetics, and that's hemoglobin A1C. And what we're actually doing is we are measuring what percentage of your red blood cells have sugar attached to them irreversibly. And If your hemoglobin A1C is 7, that means 7% of your red blood cells have sugar attached to them. If it's 14, like a patient that I saw today, that means 14% of your red blood cells have sugar attached to them. Now, to get your level up to 14, you have to run your sugar about 400 to 500, which in fact he was doing. He said, my meter doesn't work anymore. It's always reading 400 to 500s. I said, well, what'd you do? He said, well, I didn't believe my meter, so I stopped my insulin. I said, well, you should have believed your meter and not stopped your insulin. You're in real trouble. Again, what was happening? He was glycating his red blood cells. Well, what happens when you glycate red blood cells? Well, when you glycate protein, you stiffen the protein. And if you stiffen the protein in red cells, you've got trouble. As I've mentioned before, red cells are about 7 to 8 microns in diameter, and they have to flow through capillaries that are about 3 to 4 microns in diameter. And if you have to push a big thing through a little pipe, you're going to have to increase the pressure in order to get it through. And I can tell you that if I have a patient come in whose A1C, or level of glycated protein, is elevated, I know that their blood pressure is going to be up as well. Generally speaking, as your A1C goes up, your blood pressure goes up, because not only do the red blood cells stiffen, so do the arteries and so do the capillaries. And now we have another mechanism of stiffening of the arteries. We've talked about one already with salt and potassium, but here's another one, glycation, the attaching of sugar onto protein. And there's two ways this happens. The higher your blood sugar is, the higher your level of glycated protein. But you can also eat food that's already glycated. And what we find is any food that has protein and carbohydrate in it, or has fat and carbohydrate in it, that's cooked at a high temperature, the level of glycation in that food goes up. So high temperature cooking raises glycation levels, and if you eat glycated food, you'll raise your blood pressure. So a simple way to think of it is there are two white powders that are substances that raise your blood pressure, sugar and salt. And we want to keep them lower. And if you're going to have sugar, make sure you don't have it in high temperature cooking, because that will definitely increase the glycated end products and damage your blood vessels and cause high blood pressure. That's why diabetics that are poorly controlled have higher blood pressure. Well, there's one more thing I'd like to cover just briefly, and that is medications, and that includes over-the-counter medications. We often use these medications for pain relief, but we need to be particularly careful of them with our kidneys in mind. And they are acetaminophen. That's several brands out there have acetaminophen in them, ibuprofen, aspirin, and other what we call non-steroidal anti-inflammatories. There's diclofenac, there's indomethacin. All of these medications, pain relievers, tend to raise blood pressure and tend to damage kidney function. Acetaminophen doesn't do it immediately, but if you are in the habit of taking acetaminophen or Tylenol or Pandolol or whatever acetaminophen product you're taking, if you take a large amount over an extended period of time, you will definitely damage your kidney function. And you don't want to do that. So if you have to use a pain reliever, use the smallest dose for the shortest period of time possible. And always ask yourself, am I suffering from a deficiency of one of these medications, or is there something wrong I should attend to and fix it? The other thing is, if you're taking them for pain from arthritis, remember I said try flax, because flax, most of my patients tell me if they can work up to 2 tablespoons of flax meal a day, that works about as well as ibuprofen at full therapeutic dose without the side effects. In fact, you get blood pressure lowering and kidney protection rather than the opposite. So there's some things that you can do that will help pain without causing a problem with your kidneys. There are also quite a few medications that we as physicians prescribe. Diuretics are certainly one of them, and they can be very useful in the treatment of high blood pressure, but they have to be watched very closely because they also can damage your kidneys. You know, I was thinking this morning as I got out of the shower, and I had just taken a shower there, and I thought I picked up the deodorant to put it on, and I thought, you know, this is sort of like medication. I could just say, well, I won't take showers anymore. I'll just use more deodorant. And that's sort of what we do with medication. We say, well, I'm not going to worry about my lifestyle. I'm not going to clean that up. I'll just use more medication or more deodorant. And I can tell you there are not many people that would say, oh, I'll just use more deodorant, I'll stop showering, I'll be fine. We know that wouldn't be a good idea. And the same is true with medication. It can be very helpful, just like deodorant can if you're in a stressful situation. But don't give up showering just because you happen to have some on hand. And the same is true with medication. It can be very helpful, but don't give up caring for your body. Don't give up a careful diet and exercise and thoughtful living. It's a much better way to take care of your kidneys and your blood pressure. Thank you.